neurocognitive disorders arise when the brain is either damaged or impaired in its ability to function. This can have many causes, such as injury, illness, exposure to toxins, or even abuse of psychoactive drugs. There are 3 main types of neurocognitive disorders that we'll be covering, one of them being delirium, and then mild neurocognitive disorder, which is also known as mild cognitive impairment, or MCI, and major neurocognitive disorder, which we know as dementia. Starting off with delirium, it is a state of extreme mental confusion interfering with concentration and ability to speak coherently. What this means is the person could have difficulty filtering out irrelevant stimuli, being disoriented, being slow and having slowed motor behavior, and fluctuating between lucid and confused mental states. Mild neurocognitive disorder, or as I said, what some might know as MCI, is a modest or mild decline in cognitive impairment over time. It is not as serious as major neurocognitive disorder, but it still has some of the same symptoms, I guess. So the cognitive decline must be supported by formal tests, and people with the disorder can function independently, but they might find some previously easy tasks to be difficult now. In some cases, it might progress to Alzheimer's, and it frequently occurs in early stages of neurodegenerative diseases, such as AD and other conditions affecting the brain. This could be traumatic brain injury, HIV infection, and substance use-related brain disorders, as well as diabetes. The main neurocognitive disorder that we'll be covering is dementia, being major neurocognitive disorder, which is the profound deterioration of mental functioning. It is characterized by impairment of memory, thinking processes, attention, and judgment, and most frequently it is caused by Alzheimer's disease, in which case it becomes irreversible and progressive. There are other possible causes, such as brain diseases, for example, Pick's disease, as well as infections and disorders such as meningitis, HIV, and encephalitis. In some cases, it can be halted or reversed if the case is treatable, such as a tumor, seizures, metabolic disturbances, or infections. However, in most cases, it is progressive and irreversible. Usually, it occurs in people over the age of 80, and beginning after age 65, it is considered late onset, and beginning age 65 or earlier, it is considered early onset.
So now I'm going to discuss some types of dementia, because there are multiple subtypes of dementia, and they are actually really varying, and it's one of those mental disorders where there's a bunch of different subcategories and they're not all the same. So the first one at the top of your screen is young onset dementia, which occurs under the age of 65, most likely 40 to 60, and it's similar to Alzheimer's. It's Alzheimer's-like symptoms. However, it's when you're really too young to be diagnosed with Alzheimer's and notice that rapid decrease. So it's more of a pre-diagnosis to that, which, as you may know, schizophrenia used to be considered that, but now young onset dementia is its own separate thing. So basically, not everyone who gets young onset dementia will get Alzheimer's. However, you have a much higher chance if you have young onset dementia to eventually develop Alzheimer's. The next one is Alzheimer's, which is a very famous and publicized case of dementia. My grandmother had Alzheimer's, and it's a very common genetic damaging neurocognitive disorder, as it says on your screen, but basically is what many of us would consider dementia, or what we think of dementia. You slowly deteriorate with your memory and disregards all your senses, and eventually it reaches a point where it's very difficult to interact with that person or for them to be functional, which is very unfortunate. There's a lot of cure research going on right now in Alzheimer's because there is no cure currently, but as time goes on, it seems like we're doing a better job at figuring out what causes it, and figuring out what might be able to do to help prevent or treat it. So yes, Alzheimer's is our next one. After that is mild cognitive impairment, which is a less severe form of dementia. And if you have mild cognitive impairment similar to young onset dementia, you are more at risk for Alzheimer's. So in my reading, honestly, it seemed very similar to young onset dementia with less of an age factor. It's more of a less severe version of Alzheimer's. Young onset dementia was even more like Alzheimer's, I'd say. because you're younger. So as you get older, you're more likely to actually develop it. But mild cognitive impairment is something where it's like I don't want to say pre-diagnosis, but like it's something where you might get it and then you eventually get Alzheimer's as it worsens. So it might be similar to young onset dementia. Honestly, reading it, I don't know if there's much need for all three of those diagnoses, but I guess being specific doesn't hurt too much. So after that is vascular dementia, which is a more physiological dementia, and it has a very specific physical cause. It's not really, it's a cognitive disorder, but it's more, as you can see, it occurs when blood supply in the brain is blocked or damaged. So it's very interesting that affects our cognitive ability and our memory and functionality. So I would be more interested to do some more research about how that is the case and what can be done to prevent that, because it seemed like a bummer to have vascular dementia when I was reading about it and doing my research. So I didn't see much in terms of treatment, if I'm honest, and I would like to read more about that, but I didn't see much in many of the sources I looked at. So I'd be interested to see what are your next steps if you did get vascular dementia, which is a pretty severe form of it. Our next form of dementia is Creutzfeldt-Jakob disease, which I'm hoping I'm pronouncing right. It's named after the two scientists that first noticed it. It's a rare and fatal form of dementia involving abnormal prion protein in the brain. It's very rare, in fact, less than 1,000 cases per year in the United States. And it's pretty bad. There's really no treatment. It's more of like damage control once you get it. And it's not just a genetic disorder. It actually can be spread through infected meat or blood. So there's a lot of concern about keeping that person separate from other people, even though it takes pretty severe interactions, such as like a disease as AIDS, to actually transmit it. What I was reading is there was quite a bit of like bizarre fiction about this disease when I looked it up, about like a weird like take over the world dementia type thing. But of course that's more of the fiction side and less of the scientific side. But it was interesting that came up when I was researching it. But as you go on, it progressively gets worse, and there's really no treatment that we know of right now, and it eventually leads to blindness and a coma. There were some of the symptoms, so it's a pretty severe one, and if you're diagnosed with it, it is not looking good for you, unfortunately. So the next and final major subtype of dementia that is here listed for you is Down syndrome, which is also known as trisomy 21. It's a genetic disorder in which an individual is born with an extra copy of their 21st chromosome. And if you've ever taken a biology class, whether in high school or at Bellevue College or another college, you probably have had to study Down syndrome. And if you have ever been out living in the world, you've probably interacted with someone with Down syndrome. And one interesting thing about Down syndrome is that it's actually decreasing in a lot of places in the world because it can now be detected prior to pregnancy. And one interesting stat is that in Europe, 90% of pregnancies in which Down syndrome is detected are aborted. So that's not very much about the psychology. However, it is interesting to note when talking about Down syndrome in our modern world. One of my closest friends has Down syndrome, and it has a few effects, and it makes me honestly contemplate a lot of the interesting relations between biology and physiology in comparison to psychology, and a lot of genetic factors in there. And it is a very interesting disease, and we're actually coming up on Down Syndrome Day, which is in 10 days. It's on 3/21 due to the 3 copies of the 21st chromosome, which is an interesting one. So it's a disease which mainly leads to different physical and mental and cognitive impairments, which can be found in a person. However, many with Down syndrome have been able to find their place in modern society and have actually been given a chance by a lot of modern companies, and there's controversy surrounding those. However, many people with Down syndrome actually lead very fulfilling lives, and it's awesome to see in our American society and other societies across the world how we are able to help these people find their place in the world, despite having some differences from most people, which is really awesome that we're able to do that, and we should be doing more of that for sure, in my opinion at least. I mean, that's not really about the disorder of dementia, but at least a note from me is that it's awesome when we're able to kind of consider those factors about people and be sure that they can still lead fulfilling lives. For sure. There are more rare forms of dementia. However, most of these dementias are really, really small percentages. And a few of them are categorized as this because they are reversible. So all the other forms of dementia I just mentioned are really not reversible at this point in time. Once they happen, they happen. However, there are forms of dementia that are reversible, and most of those are caused by certain factors in someone's life instead of genetic factors such as drug abuse, alcoholism, or a lack of vitamins. Specifically, lack of vitamin B is what I was finding. So those dementias are actually reversible. Not all of them. However, most dementias, including the more rare forms of dementia, are not reversible, which is very interesting and almost tragic to note about them. So, yes, for sure. Thank you for listening, and on to the next slide.
President Ronald Reagan announced he was diagnosed with Alzheimer's in November 1994, which was a few years after he left office. After he announced his diagnosis, studies were done to see if he had shown signs during his presidency. The first one compared Reagan's speech pattern to other politicians, like President Carter and Vice President Mondale, and also other subjects in the study. They found that Reagan had significantly higher levels of cognitive impairment scores. In the second study, they found changes in Reagan's speaking pattern throughout the years, which associated with the onset of dementia years before his clinical diagnosis. Another study was done by Dr. Barisha also showed how his speech pattern was changing. He was using repetitive words and substituting things for specific nouns, which increased towards the end of his presidency. Also, his use of unique words declined over the years. The research and studies showed that Reagan was showing signs of progressive dementia during his presidency and was later on diagnosed with Alzheimer's. And this is a quote from Patty Davis, and she talks about how hard it was for her family and what her father had to deal with. And it says, I watched helplessly as he reached for memories for words that were suddenly out of reach and moving farther away. For 10 years he drifted, past the memories that marked his life, past all that was familiar and merciful, finally past the fear. I think a lot of people who have family members dealing with Alzheimer's relate to this, and it shows how hard it is to watch a loved one go through it and deal with something like that. And after November 1994, his disease progressed and his public appearance became more infrequent, and 10 years later, he died June 5th, 2004, which was 10 years after his diagnosis.
While dementia is currently an uncurable disease, there are many options to treat and combat it. Most of these options fall under two categories, either medications or therapies. I'm going to first talk about medications and then we'll move on to therapies from there. So the first medications I'm going to talk about are cholinesterase inhibitors. And cholinesterase inhibitors treat symptoms of dementia by slowing the breakdown of acetylcholinesterase, a chemical which plays roles in learning, memory, and cognitive skills. Cholinesterase inhibitors decrease the disorientation, confusion, and memory problems, but can present unpleasant side effects like dizziness, nausea, and vomiting. Another option which is popular are glutamate inhibitors, which prevent the overproduction of glutamate that comes with dementia. When the body produces an excess of glutamate, it leads to increased cell damage and neurodegeneration. Memantine, which is an option medication-wise, works to treat moderate to severe dementia by preventing this damage. Lastly, we can talk about general medications for managing health, mood, and behavioral issues, such as antidepressants, antipsychotics, and mood-stabilizing medications. Dementia causes mood swings, increased anxiety, and agitation, so mood-stabilizing medications can be helpful for alleviating these symptoms. A large percentage of dementia sufferers also suffer from depression, so antidepressants are used to increase the general well-being and quality of life. And although antipsychotics are sometimes prescribed for those with hallucinations and paranoia, they present a risk of dangerous side effects and are used in moderation and under careful supervision. Alongside medications, therapy is also used to treat dementia. Things such as cognitive stimulation therapy, behavioral therapy, music therapy, and art therapy are all methods used to treat the disease. Cognitive stimulation therapy, or CST, is used to help those with mild to moderate dementia and is the most common therapy method for dementia patients. CST involves training memory, language ability, and problem-solving skills in order to improve cognitive functioning and can increase memory and reasoning skills without medication and their potential side effects. Behavioral therapy is usually administered by qualified family members and loved ones of dementia sufferers or their caregivers. It treats symptoms like anxiety, aggression, depression, wandering, and insomnia. Behavior therapy involves addressing the triggers or causes of unwanted behaviors and fixing the underlying issues that go along with them. Music therapy is known to relieve stress, anxiety, and depression of the patient, as well as reducing their agitation. Musical therapy is done by gathering patients and figuring out the kind of music that they identify with or that comes from a happier time in their life, and playing it for them while they're guided through interactive exercises such as dancing, writing, anything to get the brain moving. And it's by activating the parts of the brain that the music is tied to, it reduces the effects of dementia greatly. It can bring them back from a deep haze. They're moving and they're spry. And after several music interventions, as they're called, patients have shown that the dementia has gone kind of reduced and sort of turned the time back, per se. Finally, we can talk about art therapy. Art therapy provides an engaging process for emotional healing and provides an opportunity to improve the quality of life for those with dementia. Art making can act as an important means to reinforce the emotional, perceptual, conceptual, and motor symptoms of people with dementia while placing an emphasis on their strengths. Art making involves several sensory modalities and engages complex cognitive mechanisms such as internal imagery and decision-making processes. It is this engagement and activation that has the potential to delay the progression of neuronal death in dementia cases.